Hi, this is Dr. Greg Hickman from the Andrews Institute. We got a young man having some thumb surgery, and we're gonna do a brachial plexus block on him and get him nice and numb. We got him a little comfortable here for this block. We got a little Versed on board, and we're gonna do an infraclavicular block on him. With brachial plexus block, or with hand surgery, you can do a brachial plexus block at 3 different positions. You can do a supraclavicular, you can do an infraclavicular, or an axillary block. They all work basically similarly, and you get the same results. So for hand, elbow surgery, we can use any one of those 3 blocks. Just put the probe basically the same place and come in behind the clavicle, retro to the clavicle. You can see the artery there. You can see on the right side of the screen the clavicle, and you're going to come underneath that, so you're not going to see the needle till it gets past the clavicle and gets over towards the cords. And there you go, you can see the cords pretty well right there. So that's where we're going to go. I'm going to turn this around so that we're coming in from the left side like we are on the probe, and get the same view right there. Nice view right there. You see the pec major, the pec minor, the subclavian artery with the lateral cord on the left of the artery, the posterior cord down about 7 o'clock, don't really see it well, and the medial cord over about 3 o'clock. Those are the cords. We're going to just make a little U around the artery and get our local dispersed in that fashion. Okay. All right, going to wash off here. It's a little chlorhexidine prep things up. All right. I got to go left-handed. That's not my strong suit, but I can get it done. And big bee sting right here at the skin wheel. All right. We'll bring our stimulating needle in. People do call this the raptor because we're going retrograde to the clavicle here. Really nice view there, the subclavian artery, pec major, pec minor. And I'm going to come in under the clavicle, see where we are. It's kind of hard because the clavicle, you just have to sort of ride up on the clavicle sometimes. When you're coming in, you see the needle there. And I want to add a little twitch with the lateral cord. I want to come back with the needle. I want to go a little deeper. Come in here. Now I'm coming up close to the artery. And I'm just going to lift up. I'll probably get a twitch right here. That's the lateral cord. Get the musculocutaneous twitch. So just give me 5 right there, Rocky. 5 cc's on the lateral cord there. And then sometimes you can go over the top of the lateral cord. Sometimes I'll come right in here between that lateral cord and the artery. Well, I might be getting posterior twitch there. Huh. Okay, actually I'm just going to go back and go deeper and go underneath the artery here. Pick that up. Actually, just give me 5 right there, Rocky. I'll pick that up a little bit more. That's more the lateral cord. 2, 3, 4, 5. Okay, now I'm going to come on under the artery here. Actually, the posterior cord should be down here. Well, anyway, a lot of times you don't get the posterior cord twitch, so we're just going to slide under the artery now. And if you really can't see the cords well and not sure exactly where to go and you don't get twitches, so there's our medial cord twitch. You can see the hand giving us a little twitch there, so let's do 5 right there. There you go. Might be just pushing that nerve down, that cord down.
That's 15.
Right. But what I was about to say was, if you don't see it well, if you just go right here under the artery, you can put all 30 cc's just about 6 o'clock, or from 4 to 6 o'clock, and and that'll make a nice U around the artery. So where's our needle? Right here. Now watch this. I'm underneath the artery, but I can pull the needle up. It looks like the needle's going right through the middle of the artery. It's not. We're still deep to it as I come down here. So give me, let's give 5 more right here, since we got a twitch. There we go. Try to advance a little bit. There we go. Now I'm over on the medial side of the artery. And let's do 5 more right there. There we go. You can see the vein on the medial side there. And I'm filling up local right between the vein and the artery. And now we got 5 left, so I'm just going to pull back and put this last 5 kind of right under the artery. I can find the needle again. There it was. Okay. Okay, looks like my tip's about 7 o'clock. That's where the lateral and posterior cords should be, right above and below it. So we give the last 5 right there at 7 o'clock to the artery. Yeah, give it right there. Nice spread there. Beautiful. Okay, so that's 30 cc's of 0.5% bupivacaine for the single shot brachial plexus block for his thumb surgery. And that will complete our infraclavicular block for this thumb surgery. Thank you.